Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. And welcome to our webinar on the what we call the muftarat of Sawm, the invalidators of fast in relation to medical interventions in particular, though we can talk around the topic as well, inshallah. So this particular webinar is regarding a document that I put together very recently, just before Ramadan, and hence the one that's visible on the screen. And the idea really is to explain and go through this document so that you all have some kind of understanding, or you can sort of go through the document in your own time and try to understand some of the more elaborate points in the document. Now, this is an interactive session, so it's not just about me just going through the document and it's speaking about what's on the document and doing a walk through the document, but rather at any point, if anybody wants to ask any questions, please use chat. Ideally, if you can use Q&A, that would be better. But you can use Q&A, and I will try to address some of your questions. And then every so often, I will open up a bit of time for anybody who wants to come online and ask questions as well, inshallah. Okay, so just going to the original sort of part of this document, which is, in essence, let me just get to the main sort of part of the document. So these are going to be, in essence, rulings on the invalidators of fasting. And it'll be specifically, the idea is to bridge classical Sharia or classical fiqh, usul al-fiqh, with modern day medical practice. So tibb al-mu'asara, yeah, sort of modern day medical practice, and sort of bridge the gaps between that, and try to understand how we can apply some of those principles, the usul, okay, related to the early fiqh literature, to modern day cases and modern practices. Okay, that's the idea. So let me begin by first just going through the initial parts of the document. Now, if you have seen the document, then you'll realize that there is some quite a lot of elements within that which refer to quite a lot of detail. So I'm not going to go into too much detail, mainly because I don't have the time, but I'll talk about some of the important things related to the document. So the first is, we will talk about the Sharia approach to defining the throat and relevant medical considerations related to the throat, because the throat is an important part of our anatomical structure, which determines the invalidation of fast, anything that passes the throat. So hence we need to understand what the Sharia concept of a throat is. So we'll go back to Islamic textual sources of invalidation of fast related to the throat. I'll try to expand on this so you can see a bit better. Okay. And also we will go through relevant human anatomy and physiology of head and neck relationship to the Sharia considerations of the throat. Okay. Then we will talk through the second part, which is to do with the principles that govern fasting invalidation related to the throat. So there's a couple of principles, those principles that I talked about, those kind of usul, or what we call them in essence, we call them juziyat or qawaid, that we use in determining what would invalidate our fast related to the throat. So I'll talk about them. There's 6 of them. And then there are also what we call the mawani' al-mu'tabara. So these are those things, are states that if you are in one of these states, then regardless of it passing the throat, you will be excused. Okay, and you will not invalidate your fast. So we'll talk a bit about that. Then we'll talk about the next bit, which is to do the application to medical procedures and interventions. And then after that, we will talk about invalidations of fasting related to the qualified cavities or bodily cavities. Okay, and we'll talk a bit about the legal reasoning behind that. Okay, and then we'll use some of our toolkits, and then finally the application. Okay, inshallah. So let's start, okay, by the invalidators of fasting related to the throat in light of modern medicine. So here there's a couple of things that are worthwhile mentioning. So first and foremost, we have a verse of the Quran, وَكُلُوا وَاشْرَبُوا حَتَّى يَتَبَيَّنَ لَكُمُ الْخَيْطُ الْأَبْيَضُ مِنَ الْخَيْطِ الْأَسْوَدِ مِنَ الْفَجْرِ ثُمَّ أَتِمُّوا الصِّيَامَ إِلَى اللَّيْلِ. Eat and drink until the white thread of dawn becomes distinct to you from the black thread, then complete the fast until the sunset. Here, eating and drinking is that we must refrain from whilst we are fasting. So those are very, very clear. Now, Muslim jurists deduce from this that hence eating and drinking is prohibited during fasting time. Okay. So in other words, anything that naturally reaches the stomach via a qualified cavity, this is a jawful mu'tabar, is considered to invalidate the fast. So since the throat directly leads to the stomach, anything that passes through it enters the stomach freely and independently. Because the throat is part of our anatomy, that we know that if anything enters the throat, it will pass freely, independently into the stomach as a basis of that. So hence the throat will also be considered as a qualified cavity in that particular sense. Okay. Similarly, if we go further past the stomach to the intestine, the bowels, various other things, right down to the rectal area, we know that if we were to insert anything rectally inside deep enough, then that will also pass and be absorbed through the lining, and that will also serve the same purpose as what the stomach is serving. Okay. So anything along the what we call the gastrointestinal tract, from throat right down to rectum, would be considered as a qualified cavity. Okay, and then there is some Arabic sort of classical text proofs to demonstrate that understanding. Now, when you try to determine the anatomical boundaries of the throat in the fiqh, as referred to in the fiqh literature, earliest juncture in the throat where we can confidently assert that anything which passes that area will invalidate the fast. Okay, because it will freely, independently go to the stomach. So, and the fiqh literature talks about this. So the fuqaha have very clearly mentioned that anything that freely goes past that point will invalidate the fast. So the throat is specifically also is defined as the deeper internal region of the sort of the back end of the throat. The deeper internal region, or we call the batin element, which cannot be visualized if you were to open your mouth and look at the back of the throat. You cannot normally visualize it with a naked eye, but rather it will be a point further than that. And that will be considered as the shari throat. Okay, so it's not the visible area, but not the visible area. Okay, so these are all descriptions by the fuqaha which make reference to that particular point of the throat. And then the last point they mention is that relevant area of the throat for fasting consideration is identified, where most say it would be called the wasat al-halaq. It's the middle of the actual physical throat that we recognize as throat in customary understanding and usage. So they say it's where the letter ha, the makhraj of ha, when you do tajweed, you'll understand what I mean by that. The letter ha, that's where it is articulated from. It's articulated from the middle of the throat. And we'll got a more visual understanding of that, which I'll explain later on. So recognizing that, okay, you can see these diagrams here, okay. So we have different phases that we understand from the physiology of how we swallow things. So we have what we call the oral phase. So if you look here, you will see as we consume something, this is the morsel that we're consuming. Okay, sorry. So that's the morsel we're consuming. And the morsel passes down the throat. So as it passes through, okay, like it's doing there, okay, there'll come a point, will be the oral transit and the pharyngeal phase. As it passes through, there'll come this point here, where once it's past that point, it will independently fall down. The second concept, if you look at the deeper internal area of batin, you will see that here it's actually the point of the oropharynx, which is the visible area at the back of the throat. But it's the next place, which is the laryngopharynx, where you could say this is the batin area, okay, and it's past the point of epiglottis, okay, where you can see, or where you can't see the throat, and that's the point which will be referred to, okay. So that's the second concept. So that's exactly the same place where the involuntary swallowing occurs. And then the last element, which was where the letters originate, you'll see that the letter ha originates from the center here, that point there, which is again the oropharynx again, which is that lower end, past the epiglottis area. That would be considered therefore the Sharia throat. It's the batin area of the throat. It's the place where involuntary swallowing would occur. And it's also where the letter ha originates from. It's from this area. So anything that passes this area, note where the tongue is. The tongue is here. Then there's a little gap there. And then you have the oropharynx. And then you have the pharynx lower down. So it's this area here. Once it passes there, then that is the Shari throat that will invalidate the fast. Okay. A couple of things that we need to make note of in this understanding. So if you've got an image of the tongue, so if you've got a sort of physical image of the tongue there, you can see here that the areas related to taste on the tongue, you can see that you can see the pinky area here, which is where we can taste bitter things, and then we have the sour area, and you have the sweet areas here, okay? Now, when we say we can taste something at the back of our throat, from the throat that we're looking at in terms of the Sharia throat, compared to the area where you taste at the back of your throat. So it's important to recognize that sort of proximity or that distance, shall I say. Okay, that's one thing. The other part of the anatomy that's worthwhile understanding is what we call the lacrimal duct. So the lacrimal duct, if I was to put eye drops into your eyes, they will go through the lacrimal duct, and that will fall into that cavity. And this is another image. Okay, so it'll fall into the cavity and it'll come here and it'll drop here. And at the most, when you taste it, you taste it at the back of your tongue here, which is that bitter area or sensation, the bitter sensation. Okay, whereas the throat we're talking about is down here. Okay, so clearly there is quite some, it's not very proximal to that. And just another point regarding ears. So when we talk about ears, this presentation is available, this document is available, by the way. It's available to you all. It's available to public, so you can get hold of the document. Inshallah, we will provide a link on our website as well, where you can download the document. Then we have the ear. So if you look at the ear here, okay, so even in the ear, the same kind of situation arises here as well. Okay, so you have, if you have drops that fall into the ear canal, okay, as they come down here, they go through here, and if this is the eardrum, and if that's severely ruptured, only then will you have the contents of that will go down to the pharynx. And when it goes down to the pharynx, okay, you can see that here again, this is where it will come out from these little small openings in the eustachian tube. And again, you'll taste it at the back of the throat, and not necessarily back of the tongue, and not necessarily down the throat. Okay. And if you do have anything that goes down the throat, you can understand it's very minimal amount. And it will be very clearly felt if you did feel it go down the throat. Number two, the substance must have a discernible body and not be a natural element of air. Okay, I'm going to go through each one in a bit more detail. There is an intention. There is an intention for the substance to pass the Shari throat. So that's the third element. You have to intend for it to pass your throat. If it goes past your throat, because of the fact that it's mistakenly past your throat, but it's not to the degree or quantity. Well, I'll explain that as we go through. Number four, the substance must pass through an open passage and not just absorption. Okay, so there has to be what we call a munfaz mu'tabar, an open passage. The substance must have independent stay or disappear from view. Okay, so that's an important thing. And then there is no state of forgetfulness and arduousness in the process. Okay, so this is another component. So let's just talk about the first one. The substance must pass the Shari throat. The thing to understand there is, there's a lot of text related to that. The brain was previously deemed a qualified cavity under the assumption that substances entering the facial area above the mouth, such as through the nasal, eye, or ear passages, ascended to the brain and then descended directly to the throat. That's how it was understood. Okay. However, we know contemporary understanding, this refutes that notion. So the brain is ineligible as a qualified, rendering the brain ineligible as a qualified. So the brain is not a qualified cavity because of that reason. Because it was assumed that anything that you took into the brain, however, the Shafi scholars, they consider the brain as a jawf al-mu'tabar as well, a qualified cavity. So it's acknowledged that substances entering the brain do not contribute to nutritional restoration or bodily strength as well. So they said that anything that enters the brain gives the brain nutrition. And hence, for that reason, this will be another reason to invalidate the fast. So because the brain itself, or the cavity of the brain, is an area which is a cavity, number one, and number two, it gives strength, restoration to the rest of the body, and hence that for that reason. But that is not the case. We know that that's not the situation. The second component is the substance must have a discernible body and not be a natural element of air. Okay, so the substance, or the wasil as we would normally call it, okay, so there's a nice little table that I have here which will explain that in more detail. So for example, so in the Sharia, these are terms that I mentioned: dukhan, smoke, or ghubar, dust. So we know that when we talk about smoke, we're talking about a fine solid form formed by incomplete burning. Smoke is a collection of airborne particles and gases and so forth. And we also recognize when we talk about ghubar in the Sharia, that is sort of referring to the same kind of thing as well, because that's referring to dust. Okay, so dust particles. Now, the general ruling related to that is, any substance which emits smoke forming a dark, visible, hazy appearance with a body, then this body is forcefully inhaled. So you forcefully inhale it, and it passes the throat intentionally, that will invalidate the fast. So this can be produced from fires, smoking, burning incense, or similar sources. You should not go up to those sources because it has a discernible body, and that would invalidate your fast. So smoking, you're smoking a cigarette, clearly that's a similar kind of incidence where you are inhaling fumes, okay, and hence that will invalidate your fast, okay. Now, if smoke is present in the atmosphere, okay, and it's not avoidable, then it is excused, because this is arduous. There's mushakka in it, hardship. So that is excused on the basis of that, okay. Bukhar, which is now vapor, so more like aerosol, so like inhalers, for example. So aerosol is a suspension of fine solid particles or liquid droplets in air or another gas. Aerosols can be natural. Examples of natural aerosols are fog, mist, dust, forest exudates, steam, and things like that. Okay, so what's the ruling there? Any substance which has a clear, discernible body, which is visible to the naked eye, will invalidate the fast if forcefully inhaled intentionally. Now, if you look at inhalers, they have a discernible body. They have a white mist that's visible, and you can note that white mist in an air chamber. If you have an inhaler where the mist or the vapor is clearly not visible and you inhale that, then it will not invalidate your fast. But there are, as far as my understanding goes, there are very few inhalers, if any, that the vapor is not visible. So inhalers, nebulizers, pressurized humidifiers, concentrated steam, all this stuff can be discernible, and hence it will. So things that won't be are fragrances, incense, non-visible vapor, like vapor rub, using things like that. Clearly it gives fumes, but it doesn't give visible, discernible fumes. And hence, on the basis of that, it will not invalidate the fast. So if vapor is present in the atmosphere and it is not avoidable, then it's excused. Because of that element of hardship, it will be excused. But hence, it's important to understand. Okay. Then the next bit, fumes and mist, we talked about all that, what they all are. So they're just defining what they are, steam, etc. Then you have hawa. Hawa is just air. So air is the name given to Earth's atmosphere. The three major constituents are nitrogen, oxygen, argon. So we know what air is. But generally gases that do not invalidate fast. Okay, so gases don't, because gases are not visible. most of them. So hypothetically, if the gas has a clear visible color and is concentrated and discernible with the unaided eye, it has to be unaided eye. It's not through looking through some kind of lens or whatever. So having a body, then this will invalidate the fast if intentionally inhaled forcefully. And this is quite rare for there to be a gas like that. Air and virtually all gases do not invalidate the fast as they are not discernible. They've got no obvious visible body. Okay, so they will not break the fast. Inhaling steam will invalidate the fast. I'm going back to some of your questions. Okay, inhaling steam will invalidate the fast if it's intended. If you go it, so like a nebulizer is steam to some degree. Yeah, it's like an aerosol of steam. So that's why when you're ironing and there's a lot of steam coming up from the iron, then you should try to avoid getting too close to it. Okay, and if you can't avoid it, then it's excused. But if you are doing it deliberately and inhaling it, then that's problematic. Okay, so inhaling steam will invalidate your fast because you have water droplets and they form a mist, okay, which is discernible and visible. Then it will invalidate your fast. So you might mention different types of inhalers that I may not have even heard of. But the main point to take that is what you do is you just spray it into the air. And if you can see a visible, clear visible mist, and usually it's a white mist, okay? If you can see it clearly visible, or you can spray it into an aero chamber, and if you can clearly see the visibleness there, that will invalidate your fast, okay? If it's not visible, then it won't. The second point is there is intention for the substance to pass the shari throat. Okay. So in other words, when you take something through your throat and you want it to pass your throat, well, you have to. You don't have a choice, even though you don't want it to pass the throat. It has to pass the throat to get into your lungs. So on the basis of that, for it to pass your throat to get into your lungs would require it to pass your throat. And hence that is intended, that act is intended. And hence it will invalidate your fast. So using inhalers, they're intended to pass into your chest. It's a discernible mist into your chest, into your lungs. It will invalidate your fast. Even if it be a smaller amount. Even if it be a smaller amount. The difference between that and miswak, for example. So miswak is an encouraged act in Ramadan. So if you use miswak, now there are certain juices, if I may use that term, from miswak, that may enter the throat and go down. But this is a small amount, but you don't intend to swallow them. So therefore, your intention is not for it to pass the throat, but it's done this due to arduousness, hardship. Similarly, when you rinse out your mouth when you're doing wudu, similarly, in that case, out of arduousness, some small amount of water. Some people get that sort of misunderstanding regarding us. So why, we rinse our mouth out and, some water sometimes can pass your throat, but it's unintended, does not invalidate our fast. But if it's a mistake, so you swallow quite a large amount of water when you're rinsing your mouth, that's a mistake. Khata'a is not excused. That will invalidate your fast. It's only, small remnants of water that you cannot hold back. They will go down your throat. They will be excused. So not the different how we differentiate between those two. The next component, I'm trying to answer your questions as I'm going along. The next is the substance must pass through an open passage and not just solely by absorption. Okay, so this is another important. The passage must be patent enough to pass a significant amount of liquid at least. Okay, and it can't be something that just absorbs. So that's a very important point. So we call this the manfaz al-mu'tabar, qualified passage. Okay, for it to reach the jawf al-mu'tabar with the qualified cavity. So hence the throat is a qualified passage because it's patent enough, opens enough, and so hence that will qualify. Okay, so it has to be painted. So in other words, if I put something in my mouth, sublingual, and it gets absorbed in my mouth, then that will not invalidate the fast because it's not going through a qualified passage. It's going through an absorption process through the mucosal lining of my mouth. So that will not invalidate your fast. Okay, but you should avoid flavored things in your mouth because what they do is they give you a sense of shahwa, flavor, and that is prohibited. Okay, so you can't gain shahwa, pleasure out of things in your mouth. Okay, that's another very important thing. So on the basis of that, flavor is another thing that gains pleasure. That would not necessarily invalidate your fast, but it's considered as disliked. It's makruh. So if you're using toothpaste, flavored toothpaste, it's not permissible. Well, it won't break your fast, but it's considered as disliked. You should not use flavored toothpaste while you're fasting with the intention of moistening it, and you feel it moistens the back of the throat. Will it invalidate the fast? So al yakinu la yazulu bishak. It's a maxim. Certainty is not overridden by doubt. So if you have doubt, any kind of doubt, that water has passed your throat, not just reached your throat, but passed your throat, okay, then that will not invalidate your fast. Though you're doing that deliberately, intentionally putting water into your mouth and rinsing your mouth out, that is makruh. It's a disliked act, because what you're doing is you're increasing your risk of invalidating your fast, and hence it's disliked. Okay, so you should not be doing that anyway. But and the only time that you can do it is for wudu, because clearly those are rituals that you need to do as a sunnah in your wudu. Okay. This is the next one is a Hanafi concept or Hanafi principle. Okay, and the substance must have independent stay or disappear from view. So this is another principle that if a substance enters a cavity, it must have independent stay or disappear from view. If it doesn't have independent stay, i.e., it's attached to something which extends to the outside or external, then it will not invalidate the fast. If it disappears, and if it doesn't disappear from view, i.e., it doesn't go past your throat and disappear from view, it will not invalidate your fast. So, for example, if I have the Muslim jurists, they say if you have a piece of meat on a thread and you throw the meat down your throat into your stomach and you pull it all out again, that will not invalidate the fast because it doesn't have independent stay. It's attached to a string. Now, hypothetically, that may happen, but in reality, that can never happen because you'll have remnants of the food that would remain in your stomach or along your gullet. So on the basis of that, that will invalidate your fast. Okay, so reality is it will invalidate. But hypothetically speaking, if you put an instrument like a gastroscope into your stomach through your throat, it will not invalidate the fast unless you put gel on it, which is the case, or you spray deep spray into the back of the throat as an anesthetic. All those situations will invalidate your fast. Okay, so if I was to put a suppository through my back passage, if it disappears from my view, it will invalidate the fast. If it goes deep enough, it will invalidate the fast as well. The other one is there is no state of forgetfulness, arduousness, whereby the person fasting is excused. There are states of excuse when we are excused, okay, even if they do pass our throat, okay, and these states are that exempt us from fast, from the invalidators of fasting. Okay, so what are those states? These are those states. Forgetfulness. So that when you forget that one is fasting, yeah, and you pass something past your throat, your fast still remains. Arduousness. We talked about the arduousness, hardship. So in a misty place, but you can't escape it. It will not invalidate your fast because it's out of your control. Ikra, compulsion. Somebody comes and compels another to break the fast, i.e., forcefully feeds them against their will. That will not invalidate your fast. Accidentally, khata. This is when one accidentally breaks the fast without intention, okay? But due to a slip whilst knowing they are fasting, okay? That passes the throat when gargling during ablution whilst knowing that one is fasting. That will invalidate the fast, okay? Khata'a invalidates the fast. Sleep. This is when he's sleeping and breaks the fast in sleep. So, i.e., food is put into the mouth and then somebody puts, while they are sleeping and they swallow it. That will invalidate the fast. Unconsciousness. Again, while you're unconscious, just like sleep, it will invalidate the fast. Insanity. One loses sanity due to mental illness or a confused state, no longer has the capacity to understand the rulings in this situation. Then in that situation, you are no longer mukallaf. You are no longer somebody who is obligated to fast. So and hence in that it doesn't really matter anyway, because that fast is not counted. Ignorance or jahil bil tahrim. I did not know the mas'ala. I did not know that that breaks my fast. I'm sorry, I ate, I didn't, or I did this, I used an inhaler, I did not know. That's not an excuse. Your fast will still invalidate. Okay? Because it's your job to know. It's your prerogative that you know. Now, these are the different schools according to those points. So forgetfulness, according to all the schools, except for the Maliki school, okay, they all say that in those situations, forgetfulness excuses you. Maliki says it doesn't even in that situation. When it comes to arduousness, they all agree with that, okay, that it will excuse you. When it comes to compulsion, the Hanafi and the Maliki, in this instance, they say that compulsion, even if you're compelled, it still does, you still invalidate your fast. Whereas the Shafi and the Hanbali say that your fast still remains. Okay, so if it's done accidentally, all of them say it invalidates your fast. Okay, no here means it invalidates. Yes means it doesn't invalidate. So sleep, the Hanafi and the Maliki say no, meaning that it invalidates your fast. Whereas the Shafi and the Hanbali, with sleep, they say it's an excuse. Similar thing with unconsciousness, same idea. Insanity, all of them say in this particular situation, it does not invalidate the fast. Oh, sorry, it invalidates the fast because insanity in itself sanity is a condition of fasting. Hopefully that makes sense. And then we've got the last one, which is ignorance. All of them say that ignorance is no excuse, that your fast will be invalidated. Right, so application. I recognize sort of shortage of time. Application. So eye drops or eye procedures will not invalidate the fast. Simple. I'm just going to go through this very, very quickly. Eye drops and eye, okay? In fact, what I'll do, nasal drops and sprays and nasal procedures will not invalidate the fast. Yeah. Now, that is the case unless they pass the throat. Unless they pass the throat. Ear drops and ear procedures will not invalidate the fast unless there is a large rupture of the eardrum and it clearly reaches the passage of the throat. Sublingual medication or oral procedures will not invalidate the fast, okay, unless, again, it passes the throat. Exudates, discharge, bodily expectorants in the oral cavity, which are swallowed, mucus, phlegm, things like that, will only, if it only in small quantities or cannot be avoided from swallowing, it does not invalidate. So if large amounts of it are swallowed, large amounts, it will invalidate the fast. If there's a small amount, then that is excused because of arduousness. Okay. Aerosol procedures, if the procedure requires that the fumes of the vapor reach or pass the throat, it will invalidate it. If the procedure is intended only to remain in the mouth, then fast will remain as long as it does not reach or pass the throat. That's quite, I explained that before. Procedures requiring interventions via the throat. So, for example, if the procedure involves an independent stay of the substance or dissipates from you, then this will invalidate. Okay, so that's been explained. So eye drops, so kohl, eyeliner, none of these will invalidate. Eye drops, ointment, eye procedures, none of them will. Nasal drops, nasal swabs will not. Nasal drops, sprays will not. Nasal prongs will not, unless they pass the throat. Ear sprays, ear syringing, none of them will. Sublingual medication, sprays, dental procedures will not unless they pass the throat. Dental paste will not, but it's disliked they use dental paste, which is flavored. Chewing gum, sweets, flavored toothpaste, all these things are disliked. If they pass the throat, you've broken your fast. Exudates, discharge, pus or blood from the oral, nasal, or pharyngeal cavity as long as not dominant in the saliva. So, in other words, if it's not a dominant part of your saliva and it passes through, then you will be excused. If it's a dominant part of your saliva, if you were to spit a large amount of your saliva is blood, then you know that would be, and you swallow that will break your fast if it's large amount. Similar thing with vomiting. So aerosol procedures, appliances. So will smoking, using shisha, e-cigarettes, will all inhalers, nebulizers, CPAP containing medication, steam humidifiers will. Vicks vapor rub will not. General anesthetics will not, because you can't see the steam. Perfumes, incense steams, they dislike for you to go close to them, but they won't invalidate unless you inhale them clearly. And procedures like gastroscopy, tracheostomy, nasogastric feeds, all these will invalidate the fast. And dry swabbing more. Okay? Alhamdulillah. Right, so any questions regarding the throat? Let me see if I can answer some of these questions here. Some scholars will say nasal drops invalidate their fast even if you don't pass the throat. What is their reasoning behind this? The reasoning behind this is because they say it reaches the throat. Simple as that. Yeah. Okay, so on the basis of this, you can see that anything that passes the throat, yeah, or reaches the throat will, and they basically believe that it does, and it's to a reasonable quantity, and hence it breaks the fast. So it's a misunderstanding. Okay, so let me see what else I have here. Following passages regarding ears. Hence, if the eardrum tympanum is ruptured, there is a possibility of eardrops entering the nasopharynx and hence to the oropharynx. This can only occur if there is a large enough rupture of the eardrum, and even then there is a remote chance of it actually entering the oropharynx to be sensed on the back of the tongue. Even if it does, this is not an indication that drops have passed the throat. According to the above research, does inserting medication or drops into the ear break the fast? And the answer is clearly no. The above passage suggests that there is eardrum. Okay? Otherwise, no. Insanity, I did a whole course on insanity. But insanity, junoon. Junoon is just basically somebody who loses capacity. If you use mental capacity as defined in English terms, medical terms, and you can't consent, in other words, you lose mental capacity, then you are disqualified from fasting. Okay, I have a short time, so I don't want to spend too much time. I'm just going to go through some very few basic things here. And I don't want to rush it too much, because if I rush it too much, then I know that you won't understand it. So what I'll do is I'll leave it at that point. I think the throat element is significant enough for me to leave it at that point. And then the cavity elements we can talk about in another session, inshallah. Okay, so any questions? Does anybody have any questions? If you raise your hand, I will see if I can answer your questions. Can we allow our attendees to come online? I can't seem to access the attendees. Oh, wait, I can now. So if anybody wants to ask any questions, please do raise your hand regarding the throat. Okay? If not, then I can just briefly talk about the cavities. I can see there's no questions. Just raise your hand if you have any questions. If not, okay, that's fine. Now, I'm going to give a brief overview of the throat, the bodily cavities. Okay. What is drink? What is eating? This has all been described by the fuqaha, and they explain more clear terms what that would mean, and also the slight differences that exist amongst the fuqaha, the different schools of thought. The main point to take here is Muslim jurists offer a broad understanding of abstaining from food and drink during fasting. The Hanafi and the Maliki fiqh texts, fasting is depicted as abstaining from two sources of pleasure. One is the gratification of the stomach, shahwat al-batan, and the other is the gratification of the reproductive organs, shahwat al-farj. On the other hand, the Shafi and the Hanbali fiqh presents fasting in less specific terms, focusing on refraining from actions that invalidate the fast without delving into intricate details. Now, so I'm just going to go straight to the principles that have been derived rather than the legal reasoning behind the principles. Okay, so if you go straight to the principles, okay, so there are a couple of principles. I will talk about each principle as we go through. So the first principle, there you go. The qualified cavity must be internally concealed. It must be a concealed cavity. It should be spacious, and it should have capacity to be occupied or to be filled. Okay, so that's the first principle. Anything that enters that will clearly, that would be considered as a qualified cavity. So the stomach, the throat, the intestine, and so forth, will fall within that category. Yeah. The second principle, the additional qualified cavity. So these are not just the original cavity, but the additional qualified cavities that you may, other than the womb, the uterus, or the bladder. Any of these are still cavities, aren't they? If they must be connected to the throat, stomach, or intestine directly through a patent passage which freely flows. So they have to be connected in this particular way for them to qualify. So if you look at it from that point of view, you can see, and then these are just all the evidences according to different schools. Okay, so I've got an example, for example, of the brain, I think, somewhere here, where I can give you. Okay, so look, the brain. The brain was historically regarded as a cavity under the assumption that anything entering it would eventually reach the stomach through a passage. However, contemporary understanding reveals that that's not the case. Okay, so this is not a qualified cavity. The brain is not a qualified cavity. And according to the Malikis, if a substance enters a passage high up and then proceeds to the throat, stomach, or intestine, it invalidates the fast. But that's not the case here either, because the brain clearly is not directly connected to the throat. The Shafi'is and Hanbali say even with the Shafi school, where the brain may be considered a qualified cavity, regardless of a direct passage to the stomach, the substance entering the brain must impart nutritional and medicinal strength. They say that even if it's not connected to the stomach, it should at least give you some kind of nutritional strength. So this is contrary to modern understanding, as substances typically do not provide strength to the brain, except for CSF fluid. Therefore, unless the substance reaches the brain, contributes to the strength or the body's restoration, fasting remains unaffected. Okay, that's the Shafi and Hanbali approach. Then the bladder again. So the bladder, there's no direct connection between the bladder or the urethra, which is the tube that you urinate from, to the gastrointestinal tract. So therefore, there was an understanding that's not the case. So therefore, anything that enters the urethra, the tube where you pass urine into the bladder, will not invalidate your fast. Catheters will not invalidate your fast. Cystoscopies will not invalidate your fast. Okay. Vagina and uterus. This is a misunderstood area again. So there was an understanding that with the womb is connected to the GIT tract, the gastrointestinal tract. That is not the case. Okay. So hence, anything that enters the vagina area or the uterus, the womb, in those situations, they will not invalidate the fast. So any kind of examination that you have, which is vaginal examination, smears, or anything like that, will not invalidate the fast. Okay. Qualified cavities and strengthening the body. So this is a lot of evidence to suggest that the ulama or the fuqaha did mention strengthening the body, an important element in this as well, or nutritional value. So if the additional qualified cavity is not connected to the throat, stomach, or intestine directly, then it should at least be a means of strength and restoration to the body. So in other words, you've got an additional cavity. It provides strength and nutrition and medicinal qualities to the rest of the body, then it will still qualify. So demonstrate here, okay, that hence we've got, this is quite an important point here, actually. I won't go into that because you're going into a lot of detail then. We unfortunately don't have the time for that. But if you read the article, it's self-explanatory. Hopefully you'll understand it by reading the article. Okay, so on the basis of this, if you look here, so in this diagram, you can see that you've got the gastrointestinal tract. Okay, so this is the gastrointestinal tract. And the blood supply that supplies this gastrointestinal tract will absorb all the nutrients through the lining. Anything that enters these cavities will invalidate the fast. But it all goes through the hepatic portal vein into the liver and gets detoxified there. Okay, and that's the process that they all go through. Okay, so here, and then once it gets detoxified, it goes to the heart and gets pumped around the whole body, and hence it gives restoration and strength to the rest of the body. And nutrition and medicinal properties will have an impact on that as well. Now, if you look at the brain from a perspective, similar kind of perspective, we can see that the brain has CSF fluid. Okay, and At any given time, approximately 125 mils of CSF is present. 500 mils is generated daily. So the brain's ventricles, they clearly store some of this fluid. But in conclusion, the brain's internal cavities or ventricles house CSF with a volume of no less than 100 mils. Given that, Muslim jurists recognize the brain as an additional qualified cavity because of that reason. And this volume can be considered a reliable indicator of the minimum capacity required for a cavity to qualify as such. So I explain all the principles in line with that, and then I'll explain the conclusion on that as well at the end when it comes to the brain. So the conclusion there in that one is there is no natural passage, especially to the throat, nor is the brain directly connected to the throat, stomach, or intestine through any means. So the shunt system, you can sometimes have shunts from the brain to the stomach, have a closed system and will only invalidate if external fluid is infused or injected. It goes into quite a bit of detail specific to the brain. Those are the main principles anyway. And what I just want to emphasize is the circulatory system. I'll leave the brain for the moment. The lungs, again, that is a cavity in itself, a qualified cavity. Anything that goes into the lungs will invalidate the fast as well because of that reason. The additional qualified cavity must have a patent entry. Okay, so there must be an existence of a passage, and the width of the passage should be big enough to allow reasonable amount of substance through it, not just a minuscule microscopic amount. So there has to be an existence of a passage, and it has to have a certain width to it. So these are clear principles I mentioned. So on the basis of that, if you look at the okay, so if you look at the circulatory system, okay, just before we go to the circulatory system, you can see there is an area, okay, above the pectinate line, which is where food and everything or any kind of medicine is absorbed. So if you put suppository high enough in there, okay, that will absorb and that will invalidate the fast. Whereas the lower end of the rectum, it won't. Okay, so that's an important point to take note as well. Now, in terms of the circulatory system, that's an important point, the circulatory system. Okay, so just to give you a bit of an idea, if you look at this diagram, so these are the kind of questions you need to ask yourself. Number one, does it follow the description of a cavity? And it's concealed, it's spacious, and it can fill? Yes, it does. No, it doesn't. Then it does not qualify as a cavity. Then the next question you need to ask is, it is connected to the throat, stomach, or intestine through a patent passage? No, it's not. Then it's not a qualified cavity. Yes, it is. Or it is a means of strength or restoration to the body itself? Yes, it is. So then it falls into the next area. And that is that it has a patent passage which opens externally. So if you look at the circulatory system, our blood system, that is a cavity in itself. It can store immense amount of fluid, i.e. blood. Okay. It is not directly connected to the throat, stomach, or intestine, but it is a means of strength or restoration to the body itself. So it falls within that category. And only when it has a patent passage which opens externally will it invalidate the fast. So if I put an IV fluid, intravenous fluids, into your vein, which connects to your circulatory system, then it's a patent passage to the external. That will then invalidate the fast. Blood transfusions, IV fluids, also hemodialysis, and also peritoneal dialysis. So peritoneal dialysis, what you're doing is you're placing immense amount of fluid into the abdominal cavity or the peritoneal cavity. And there, a lot of that, okay, will go into the hepatic portal vein, into the liver, the same way as it will be absorbed in the lining of the gut. No different. So hence, on the basis of that, that will invalidate the fast as well. Have a substance that does not need to have nutritional and medicinal benefit. So it doesn't have nutritional benefit, but it enters an entry point from the external surface. It goes through a patent passage to the throat, for example, and then another qualified passage to the intestine, and then into the blood circulation, that will invalidate the fast. Okay, let's move on to the next one. So if you, let's say, swallow a pebble and it goes down the throat into the stomach, it will invalidate the fast. It will not invalidate the fast. So substance that does not need to have nutritional medicinal benefit, it still does not have nutritional benefit, but it does have substance that has nutritional benefit. Either one, if it passes the patent passage into a qualified cavity and it goes into blood circulation, it will invalidate the fast. Because clearly by going into the qualified cavity, it will automatically go into the blood circulation, it will get absorbed. Okay, but even if it doesn't, the fact that it's gone into a qualified cavity is sufficient enough. Okay, and then the last component is substance that has nutritional value or medicinal value. It enters a patent passage and it goes directly into the blood circulation. Okay, it doesn't go into the qualified cavity, it goes directly into the blood circulation. That will also invalidate the fast. But if you give yourself a substance that goes, the entry point is not a qualified passage, but rather it goes into the soft tissue, around the fatty tissue, underneath the skin, into your muscle or another area. There's no patent passage injections in just underneath the skin that you may give, steroid injections. Any kind of injection that you give into the joints on any of those areas will not invalidate the fast. Okay? So hopefully that makes sense. Let me get to the last bit here and then it'll sort of outline the final conclusion. So we talked about the throat. We talked about all the different elements of the throat. So let's just quickly just go over the... So vaginal uterine interventions, they will not invalidate the fast. Anything vaginally will not invalidate the fast. So that includes examination procedures, ultrasound, manual colposcopy, hysteroscopies, tampons, vaginal creams, pessaries, coils. None of them will invalidate your fast. Vaginal sexual intercourse will invalidate, okay, involving male and genital penetration, which is clear in the text. Okay, menstrual discharge, blood, postnatal bleeding, all these will invalidate the fast. Bladder interventions, the urethra, bladder are not qualified cavities as they do not provide stents. So anything that like cystoscopies, urinary catheters, suprapubic catheters, none of them will invalidate the fast. Rectum and anal, they will invalidate unless it does not pass the pectinate line and in solid form, which does not appear from view or have independent state. So endoscopies, proctoscopies, manual rectal examination with gel will invalidate, which exceeds the pectinate line. Enema, suppositories, and all bowel irrigation, all these will invalidate. What will not invalidate is dry manual examination, which doesn't really happen. Anal creams, as long as it's just around the anal area like piles. Performing istinja won't, without the finger going above the pectinate line. Suppositories which do not pass the pectinate line. Any solid object which does not appear from view, disappear from view. Okay. So spinal and brain interventions will generally not invalidate the fast, and I explained that earlier on. Abdominal wall interventions will invalidate the fast only if external passage is surgically introduced, which is connected directly to the essential qualified cavities. So, for example, peg feeds will, direct instrumentation that paces the essential qualified cavities will. What won't will be laparoscopy, as long as large amounts of fluid are not flushed into the peritoneum. Colostomies won't, stomas won't, where substance is discharged, it's not actually flushed into the system, it's discharged, so it won't. So direct entry into the circulation, the blood circulation that is, the fast will only invalidate strength and hydration, and it is injected directly into the venous arterial system. You put something like contrast, then the contrast itself, okay, stents, probes, microtubing, cannula, all these will not invalidate the fast. Whereas IV fluids, drips, blood transfusion, renal dialysis, all these will. Okay. Entry or indirect entry into circulation will not invalidate. So skin will not invalidate, So creams, lotions, patches, absorption of skin, because the pores are not patent passages. Okay. So creams, nicotine patches, HRT patches, steroid creams, Acupuncture will not invalidate the fast. Sublingual will not invalidate because there's no patent passage into the throat. It's absorbed through the lining. So nitrate sublingual tablets, sprays, they will not invalidate the fast. Injections will only invalidate if large amounts enters the peritoneal cavity. So subcutaneous, subdermal, intramuscular, intraosseous, interarticular injections will not invalidate the fast regardless of them entering the blood circulation because they're not qualified entry sites. Yeah. So insulin, vitamin injections, steroid injections, vaccinations will not invalidate the fast. And then the peritoneal cavity, we talked about that, will only invalidate if large amount enters the peritoneal cavity. Okay, so peritoneal dialysis will invalidate as large amounts of fluid enter the portal vein and clearly provide strength to the body. So if the amount is small, then it will not invalidate. So peritoneal lavage, aspirations, drainage will not will invalidate the fact, will not invalidate as aspirating fluid from the peritoneal cavity does not. But you're taking fluid out. If you're putting it in, then that will invalidate. Lungs, bronchial interventions will invalidate as will need to pass the throat. Not only that, but the lungs are actually potentially qualified cavity because you can put in things that give you strength through the lungs, like, for example, or medicinal properties like inhalers do. So in essence, even though it's not mentioned clearly here, they will invalidate the fast. So any substance, even if non-nutritional medicinal value, which passes throat, will invalidate. If a substance has medicinal benefit, will invalidate as well if vapor is discernible. Smoking shisha, cigarettes, inhalers, nebulizers, all these will invalidate. Vicks, vapor rubs will not. General anesthetics will not, on the basis of the lung being a cavity. Okay, inshallah. So that's the end of that. Or is this only a consideration? So, okay. Can you advise us on a good online fixed school that has live lectures? Okay, that's a separate question, not relevant to this. Then we got a question from Nabiha saying, what about B12? This is American. B12 injections due to route not qualified entry site. Okay, so B12 injections, intramuscular injections, they're usually given into intramuscularly or they're given subcutaneously. Even if it provides strength, that's not a qualified cavity, okay? And it's not a patent passage to a qualified cavity. So they would not, okay? Even though they give strength, they would not, because they don't qualify as a cavity. Okay, somebody wanted to ask a question. Imran Saeed, you want to come online, ask your question? Just 1 second before you ask your question, because I think I'm not picking up.
Assalamu alaikum, Sheikh. Can you hear me?
Wa alaikum salam. I can hear you now. Alhamdulillah.
Yes, brother. Sheikh, I have two questions. The first one is for dental procedures, when they give the local anesthetic, is that okay? And also, they'll be doing suctioning after they put the fluid there, the water. So there is a chance that it may enter the throat. So what do you think is a good idea? Not to undergo dental procedure or not to fast when you're going for a dental procedure and do it later? And I just wanted your opinion about this.
Okay, very good question. Giving local anesthetics into the mouth do not invalidate the fast. Okay, that's the first thing.
Mm-hmm.
And using suction in the mouth does not invalidate the fast because you're extracting something. You're not actually putting anything into the mouth or the throat. And on the basis that you're struggling swallowing them, it's disliked. It's makruh really. So you should avoid dental procedures when you're fasting. Though they won't break your fast unless you swallow them.
Sounds good, Sheikh. I have another question, Sheikh, if you don't
Yeah,
mind.
yeah, go ahead.
Sheikh, when we have sinusitis or any chronic nasal drainage, and you get the phlegm and the mucus in the throat, and if you're having difficulty to spit it out, for example, you're driving the car, so at that time, is it okay to swallow it, or is better to spit it out in?
Okay. So if with mucus, it's naturally formed because of so it's out of your control. Okay, so it falls under the rulings of arduousness, hardship, mushaqqa. Yeah. And for that reason, you're excused generally, you're excused anyway. If you are deliberately swallowing lots of mucus, yeah, arguably, and I'll put it in arguably, it will invalidate your fast. But generally speaking, most scholars would say it's disliked that you're doing that, but it won't invalidate your fast.
Sounds good. Jazakallah khairan, Sheikh.
But you see that blood is not natural to be in your mouth. Okay, so or vomit. the contents of your stomach. It's not natural that they regurgitate and come into your mouth. That's not a natural place for them to be. If you swallow them in large amounts and you do it deliberately or intentionally even, then that will invalidate your fast. Okay, so that's the difference. Okay, I think you got somebody else wanted to raise a hand? No? Okay, inshallah. That's fine. I think okay. And then we have the thing with vitamin B12 injections, I recognize that even they do give some kind of nutritional value because it's vitamins. But the fuqaha are very, very clear. Number one, it has to be a patent passage. Okay. And it has to go to a qualified cavity. So they don't do that. Okay. So vitamin D injections won't have a patent passage, and it won't go to a qualified cavity directly. It'll have to be absorbed. Okay. So that's the first thing. The second thing is that uh, that's the main reason why, in essence. And if you place the vitamin B12 through a patent passage into the circulatory system, like a venous, through a drip or something like that, then that will invalidate the fast. Okay, because clearly you're placing in there a significant amount which is going into the bloodstream. Okay, so that will invalidate, otherwise it won't. So hence, same thing goes with insulin and various other things. Insulin has medicinal properties. So same thing with insulin. Okay, let me see if I can answer some of the document will be available, inshallah, on the website shortly. Okay, 1 second. And if you go to the website, you'll be able to pick up that document. Inshallah, there'll be other articles as well. I've done a few other articles as well with some of you, and there'll be more articles that are coming. There'll be a whole page with all my work on there. Inshallah, I'm planning to do that on various topics, not just this, and that will be available to you, inshallah. Okay. If there's nobody else who wants to ask any more questions, inshallah, we will leave it there. And may Allah subhanahu wa ta'ala make your Ramadan fruitful. And our sole purpose in Ramadan is to gain taqwa. At the end, by the end, we should have gained an immense amount of taqwa, which should keep us going for the whole year until the next Ramadan, at least. So on the basis of this, we pray to Allah, Ya Allah, give us taqwa so that we are able to uphold your deen. And Ya Allah, give us a heart which is conducive to your ways and your traditions that are of immense benefit for us. Ya Allah, and increase our ta'alluq with you, our connection with you in this beautiful month so that we gain immense reward and immense favors that will benefit us in the khair of this dunya and the khair of the akhirah. Subhana rabbika rabbil izzati amma yasifun. Wassalamun ala al-mursaleen. Walhamdulillahi rabbil alameen. Assalamu alaikum wa rahmatullahi wa barakatuh.